Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Understanding what MCHC blood test results mean corpuscular hemoglobin concentration, MCHC, is a blood test that calculates the average concentration of hemoglobin in red blood cells in relation to their total volume. /R/N/R/N hemoglobin is an iron-rich protein in red blood cells that carries oxygen to tissues, and gives blood its red color. Measuring hemoglobin through an MCHC test can help determine whether you have anemia, a condition where you have either too few red blood cells or too little hemoglobin. /R/N/R/N both high or low MCHC values may indicate anemia. It is only when the MCHC results are compared with other blood test results that healthcare providers can narrow the possible causes, which may include iron deficiency, blood disorders, or even cancer. /R/N/R/N an MCHC blood test is part of a panel of tests called the red blood cell, RBC, indices. These tests evaluate the composition, size, and volume of red blood cells. The RBC indices, in turn, are part of a larger panel of blood tests called the complete blood count, CBC. /R/N/R/N the MCHC is measured in values of grams per liter, g/dL. The reference range of values for the MCHC test is 32 to 36 grams/dL. Anything between these values is normal. /R/N/R/N results that fall outside of the reference range are interpreted as follows. /R/N/R/N a low MCHC is typically a sign of iron deficiency. As iron is a major component of hemoglobin, a loss of iron can cause hemoglobin concentrations to drop, leading to iron deficiency anemia. /R/N/R/N other possible causes of a low MCHC include /R/N/R/N a low MCHC without anemia may also indicate iron deficiency before anemia develops. /R/N/R/N a high MCHC may be due to different types of anemia. One of the main causes is hemolytic anemia. This is when red blood cells die, or are killed faster than they are produced. When this happens, the hemoglobin concentrations may be high even as the red blood cell counts drop. /R/N/R/N causes for this include /R/N/R/N two different formulas can be used to calculate the MCHC, the value of which is reported as grams per deciliter, g/dL. Using two methods can improve the accuracy of the reading. /R/N/R/N the primary method of calculating the MCHC is based on the result of two different blood tests. /R/N/R/N for this method, the MCHC is calculated by multiplying the Hgb value times 10 and then dividing that number by the HCT, as follows, /R/N/R/N/Hgb 10, HCT equals MCHCG/dL/R/N/R/N. The secondary method looks at other aspects of red blood cells and hemoglobin, specifically their size and mass. The formula is based on the results of the following tests. /R/N/R/N for this method, the MCHC is calculated by dividing the MCH value by the MCV value as follows. /R/N/R/N equals MCHCG/dL/R/N/R/N. An MCHC blood test requires a simple blood draw taken by your healthcare provider or in a lab by a phlebotomist. It is not performed individually but as part of the CBC. Only one test tube of blood is needed for a CBC. /R/N/R/N while no preparation is needed for an MCHC test, you may be asked to fast several hours before the test if other blood tests are included as part of the evaluation. This may include tests like fasting plasma glucose, FPG, liver function tests, LFTs, iron studies, or kidney function tests. /R/N/R/N as with all blood draws, The sample is taken from a vein in your arm using a needle and vacuum-sealed test tube, which helps suction out blood. Side effects are few and generally mild, sometimes causing localized pain, bruising, or temporary dizziness. /r/n/r/n The MCHC is not a direct measurement. Rather, it is an estimate based on measurable values like hemoglobin and hematocrit, both of which are vulnerable to transient changes. Because of this, any condition that can throw off these values can throw off the MCHC as well. /r/n/r/n examples include /r/n/r/n because different factors can throw off MCHC results. Labs will often use both formulasHgbHCT and MCH/MCV to get a more reliable value. /r/n/r/n In addition to MCHC, there are other tests and procedures used to diagnose the type and cause of anemia, including /r/n/r/n mean corpuscular hemoglobin concentration, MCHC, is a measure of the concentration of hemoglobin in red blood cells. A normal MCHC is typically between 32 grams/dl to 36 grams/dl. A higher or lower MCHC may indicate different types of anemia. Other tests may be used to help narrow the causes. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.